Tinnitus involves hearing ringing or other sounds in one or both ears that aren't caused by an external source and usually can't be heard by others. It affects 15% to 20% of people, particularly older adults. Symptoms of tinnitus. Tinnitus is commonly described as a ringing in the ears when no external sound is present. However, it can also manifest as other phantom noises, including buzzing, roaring, clicking, hissing, humming. Most people with tinnitus experience subjective tinnitus, meaning only they can hear the noises. The pitch of these sounds can range from a low roar to a high squeal, and they may be heard in one or both ears. Sometimes the noise can be so loud that it interferes with your ability to concentrate or hear external sounds. Tinnitus can be constant or intermittent. In rare instances, tinnitus can present as a rhythmic pulsing or whooshing sound that aligns with your heartbeat, known as pulsatile tinnitus. If you have this type, your doctor might be able to hear your tinnitus during an examination, a condition known as objective tinnitus. When to consult a doctor? Tinnitus affects individuals in varying degrees. Some may find it manageable, while for others, it can significantly impact daily life. If tinnitus is causing you distress, it's important to consult your doctor. Schedule an appointment if you develop tinnitus following an upper respiratory infection, like a cold, and it doesn't improve within a week. Seek immediate medical attention if you experience hearing loss or dizziness alongside tinnitus. Tinnitus is causing you significant anxiety or depression. Causes of tinnitus. Several health conditions can trigger or exacerbate tinnitus, and sometimes the exact cause remains unknown. Common causes of tinnitus. Hearing loss. Tiny hair cells in the inner ear, cochlea, move in response to sound waves, sending electrical signals along the auditory nerve to the brain, which interprets them as sound. Age or prolonged exposure to loud noises can damage these hair cells, causing them to send random electrical impulses to the brain, resulting in tinnitus. Ear infection or ear canal blockage. Ear canals can become blocked by fluid, ear infection, earwax, dirt, or other materials, altering ear pressure and causing tinnitus. Head or neck injuries. Trauma to the head or neck can impact the inner ear, auditory nerves, or brain function related to hearing, often causing tinnitus in one ear. Medications. Certain medications can induce or worsen tinnitus, especially at higher doses. The noise usually subsides once the medication is discontinued. Drugs known to cause tinnitus include nonsteroidal anti-inflammatory drugs, NSAIDs, some antibiotics, cancer drugs, diuretics, anti-malarial drugs, and antidepressants. Other causes of tinnitus. Meniere's disease, an inner ear disorder that can cause tinnitus due to abnormal fluid pressure in the inner ear. Eustachian tube dysfunction occurs when the tube connecting the middle ear to the upper throat stays open, causing a sensation of fullness in the ear. Ear bone changes. Otosclerosis, a condition involving the abnormal growth of bones in the middle ear, can impair hearing and cause tinnitus. This condition often runs in families. Muscle spasms in the inner ear. Involuntary muscle contractions in the inner ear can lead to tinnitus, hearing loss, and ear fullness. These spasms can occur without an obvious cause or due to neurological disorders like multiple sclerosis. Temporomandibular joint, TMJ. Disorders. Problems with the joint connecting the lower jaw to the skull can result in tinnitus. Acoustic neuroma or other tumors. Non-cancerous tumors on the cranial nerve affecting balance and hearing, such as acoustic neuromas, can cause tinnitus. Other tumors in the head, neck, or brain can also lead to this condition. Blood vessel disorders. Conditions like atherosclerosis, high blood pressure, or malformed blood vessels can alter blood flow, leading to tinnitus or making it more noticeable. Other chronic conditions, diseases such as diabetes, thyroid issues, migraines, anemia, and autoimmune disorders like rheumatoid arthritis and lupus, are also associated with tinnitus. Risk factors for tinnitus. Certain factors can increase the likelihood of developing tinnitus. Loud noise exposure. Frequent exposure to loud noises, such as from heavy machinery, firearms, or loud music, especially for those in noisy professions. Age. Aging can reduce the number of functioning nerve fibers in the ears, often leading to tinnitus. Sex. Men are more likely to experience tinnitus than women. Tobacco and alcohol use. Smoking and alcohol consumption increase the risk of tinnitus. Certain health problems. Conditions like obesity, cardiovascular issues, high blood pressure, arthritis, and head injuries can raise the risk of tinnitus. Complications of tinnitus. Tinnitus impacts individuals in various ways and can significantly affect quality of life. If you have tinnitus, you may also experience fatigue, stress, sleep problems, trouble concentrating, memory problems, depression, anxiety and irritability, headaches, problems with work and family life. Addressing these associated issues may not directly reduce tinnitus, but it can improve your overall well-being. If you find this video useful so far, please like and subscribe before we move on to diagnosis and treatment. Thank you for your support. Diagnosis of tinnitus. Doctors typically diagnose tinnitus based on symptoms alone, but will also seek to identify any underlying conditions. To determine the cause, the following methods are commonly used. Hearing, audiological exam, conducted in a soundproof room with earphones transmitting sounds to one ear at a time. Your responses are compared to normal hearing results for your age to identify possible causes. Movement tests. You may be asked to move your eyes, clench your jaw, or move your neck, arms, and legs. Changes in tinnitus during these movements can help identify underlying disorders. Imaging tests. CT or MRI scans may be recommended based on the suspected cause of your tinnitus. Lab tests. Blood tests may be conducted to check for conditions like anemia, thyroid issues, heart disease, or vitamin deficiencies. Describing tinnitus noises to your doctor. Providing a detailed description of the tinnitus noises you hear can help your doctor identify a possible underlying cause. Clicking may indicate muscle contractions in and around the ear, pulsing, rushing, or humming, often related to blood vessel, vascular issues, such as high blood pressure, and may be noticeable during exercise or when changing positions. Low-pitched ringing could suggest ear canal blockages, Meniere's disease, or stiff inner ear bones, otosclerosis. High-pitched ringing, the most common type, often due to loud noise exposure, hearing loss, or medications. Continuous high-pitched ringing in one ear may indicate an acoustic neuroma. Treatment for tinnitus. The approach to treating tinnitus depends on its underlying cause. If an underlying health condition is identified, addressing it can often alleviate tinnitus symptoms. Here are some treatment. Earwax removal. Clearing an earwax blockage can reduce tinnitus symptoms. Treating blood vessel conditions. Conditions affecting blood vessels may require medication, surgery, or other treatments. Hearing aids. If tinnitus is related to noise-induced or age-related hearing loss, hearing aids can help. Medication adjustment. If a medication causes tinnitus, your doctor might recommend stopping, reducing, or switching the drug. Noise suppression. When tinnitus can't be cured, treatments to make symptoms less noticeable include white noise machines. These produce static or environmental sounds, like rain or ocean waves, to mask tinnitus, especially useful during sleep. Devices like fans, humidifiers, and air conditioners can also help. Masking devices. Similar to hearing aids, these produce continuous low-level white noise to suppress tinnitus. Counseling. Behavioral therapies can help you manage tinnitus by altering your perception and emotional response to the condition. Tinnitus Retraining Therapy, TRT, combines sound masking and directive counseling to help you become less aware of tinnitus over time. This therapy is usually guided by an audiologist. Cognitive behavioral therapy, CBT. A mental health professional can help you develop coping strategies to make tinnitus less bothersome. CBT also addresses anxiety and depression related to tinnitus and can be done individually, in groups, or online. Medications. While drugs can't cure tinnitus, they may reduce symptom severity or associated complications. Medications might be prescribed to treat underlying conditions or to help manage anxiety and depression linked to tinnitus. Potential future treatments. Researchers are exploring brain stimulation techniques such as transcranial magnetic stimulation, TMS, and deep brain stimulation to potentially relieve tinnitus symptoms. Lifestyle and home remedies. While tinnitus often can't be fully treated, many people find that certain lifestyle adjustments can make the symptoms less bothersome. Here are some tips that may help. Use hearing protection. Prolonged exposure to loud sounds can damage ear nerves, leading to hearing loss and worsening tinnitus. Always wear over-the-ear hearing protection when using chainsaws, working with loud machinery, playing music, or using firearms. Turn down the volume. Listening to music at high volumes through headphones can contribute to hearing loss and tinnitus. Keep the volume at a safe level. Use white noise. In quiet settings, tinnitus can be more noticeable. A white noise machine, or a fan, soft music, or low-volume radio static can help mask the tinnitus noise. Limit alcohol, caffeine, and nicotine. Excessive use of these substances can affect blood flow and may contribute to tinnitus. Reducing their intake might help manage symptoms. Alternative medicine. While there's limited evidence supporting the effectiveness of alternative medicine for tinnitus, some therapies have been tried with varying results. Acupuncture, ginkgo biloba, melatonin, zinc supplements. To better manage tinnitus, consider these strategies. Join support groups. Connect with others through in-person or online groups, preferably led by a healthcare professional. Educate yourself. Learn more about tinnitus and management techniques to make symptoms more manageable. Manage stress. Use relaxation therapy, biofeedback, or regular exercise to reduce stress, which can worsen tinnitus. Thank you for watching. We hope you found this information on tinnitus helpful. If you did, please like and subscribe for more health-related content. Feel free to leave any questions or comments below. Take care and see you in the next video.